Welcome back. We're joined today by Jay Kempton, CEO of the Kempton Group. And Jay, we were just starting to ask you about the Free Market Medical Association that we're hearing and seeing a lot about. Can you describe that and explain what that is?
Yeah, sure, Michael. Free Market Medical Association is a trade association that Keith Smith, myself, and Charles Sauer put together. And it was really an association that we wanted to bring together buyers of healthcare goods and services, which would be self-insured employers, individuals, and then also sellers of healthcare goods and services, which would be doctors, hospitals, facility owners, et cetera, and try to get them all in the room and start talking to one another with very little intervention from a third party like an insurance company or there is one other besides just buyers and sellers. There's also intermediaries that we do invite. I'm an intermediary for sure, and I think I was chosen to be one of the founders so I could keep a close eye on the people like me, because the third party in healthcare is really the one that has driven the costs up and raised the complexity.
I've got to ask you, you've mentioned a couple names here, and you talked about, we did have Dr. Smith on here before, and we had a couple questions posted to our site, and we've seen this elsewhere, where one of the challenges is there may be a cost savings, but there's concern about either the quality of the technology or the quality of the care. Is it equal, apples to apples? You're working with businesses and looking at what options are out there for them and with consumers.
Sure.
Help us address that question. How should we be answering the folks that ask?
You know, the way that we address it is we give the information about the facilities to the patients before they ever choose to utilize one of those facilities and allow them to do their own research for quality. They can tour the facility, they can meet their surgeon, et cetera. But there's an important economic reason why the facilities that are choosing to offer bundled cash pricing are really on the top of their game when it comes to quality and outcomes, and it's the nature of the pricing for their procedures being bundled. In a traditional insurance sense, you know, if there are complications or there's problems that have to do with the patient, those complications are all billable. So in other words, the more things that go wrong, usually the bigger the medical bill. In a situation where a facility offers a bundled cash price, for instance, for a hip replacement, the facility already knows, so does the surgeon, how much they're going to get paid before they ever see that patient. And if there are problems, or you know, if your procedure is supposed to take an hour and a half, but instead it really takes 3 hours, there's no ability for them to bill additional. So it really provides an incredible incentive for the facility, the surgeon, and all the different component pieces to really be on top of their game. And the facilities get to choose what procedures that they're willing to offer under this type of a marketplace. So if it's not a procedure that they really feel like they're on the top of their game when it comes to quality, they may just not choose to offer it under a bundled cash arrangement. But the bundling really does drive quality.
And these facilities are advertising their services and letting people know. I mean, people have ways of finding out whether they're successful, right? And your company would care about that. The company's providing that. So, I mean, is there transparency on the results side as well?
Yeah, it usually ends up in the break room of the employers. If an employee is chosen to have a procedure done at one of these types of facilities, it's their choice. This is not a PPO network where you're given a list and these are the places that you have to go to. These are voluntary choices, and if these facilities weren't taking good care of their patients, they wouldn't see the number of patients continue that are choosing these types of facilities continuing to grow over time.
We talked about the Supreme Court case and the hearing that just came up, oral arguments, if you will. I have to ask you, here's a quote I'm going to read from Attorney General Pruitt. We're not children, this was in the Wall Street Journal, we're not children who must be protected by the federal government from making choices. There's a lot of conversation nationally about this comment that he made. You're in the healthcare profession.
Right.
What do you think? Do you agree with him, and why do you think he made the statement?
I completely agree with Mr. Pruitt. We really do not need to be protected from ourselves. The employers and the employees that have really kind of embraced this movement, they were all skeptical at first because it seems a little bit too good to be true. But once an employee or an individual starts to understand that they really do have a say and they really can have a choice in who they choose to do their procedure, and those choices are not based on who's in a book. The choices are based on quality and transparent pricing. And if they choose not to utilize one of these facilities, then they're going to meet their deductible and have regular benefits. But if they choose to avail themselves of a bundled cash price, because those prices are so much better than what you see out there in the standard insurance plan, their employer is going to pay for it at 100%, but it's still their choice.
Trent, we have about a minute left. I'm going to let you get the last question.
Well, we've talked about choices in education. We talked about choices in
Right.
healthcare. I mean, treating people as consumers is empowering, right? And,
You bet.
and it benefits. I mean, you're saying it benefits the bottom line, but I mean, do you see benefits for people beyond just their pocketbooks?
It's a great question. I appreciate you asking that one because it allows me to brag on some of these facilities. Dr. Smith has been doing this longer than anyone else, but there's several other facilities that are doing this now. And what we're beginning to find that since the patients that are coming to them under this model have chosen them, they didn't come there because it was, their insurance company told them to. They're voluntarily coming to these facilities. These facilities are starting to actively compete for their business. In other words, they want that patient when they go back to their employer or back home, they want that employee to tell everybody they know about how good they were treated.
Well, Jay, thanks so much for being with us here today. We really appreciate it. And folks, we're going to be right back with some final thoughts right after this.